Hey Guru Nation, welcome back to the clinicaltrialsguru.com. Literally just finished a podcast right now on why should you or should you not partner with someone when starting your own research clinic. And then it gave me this idea for like this micro video, 3 to 5 minutes, on the topic of study coordinator salary and how to measure how many patients you need a week or a month just to pay that coordinator salary. So this is assuming you're not the coordinator. Let's say you're the PI owner or you're just an entrepreneur and you can't be the coordinator, okay? Not because you don't know how, because I think you can learn, but you don't have time, all right? You make too much money somewhere else. You want to start this research clinic as a side project, or you want to start this research clinic and build it up and start scaling, and you need to figure out, okay, well, I can't do this on my own. I need to hire a coordinator. So a coordinator, an experienced coordinator, depending on where you are in the country, anywhere from 40K to 80K a year, more or less. I know people are going to say, well, actually, we pay less or we get more. I get it. This is like ballpark numbers, okay? 40 to 80K a year salary, depending on where you're located in the country and how much experience they have. Now, a lot of people are surprised. Well, it doesn't take, hey Dan, I've been to your website where you have a tab that says start your own clinic with or without my help. I realize there's not much I need. Like, there's no special certifications, licenses I need. I just need a CLIA waiver. I need GCP for all my staff. I need IATA for the person processing the lab samples and shipping the lab samples. But we don't need much. And that's true. But costs add up. So just study coordinator salary, okay? 40,000 to 80,000 a year. So you're paying anywhere from just under $4,000 to just under $8,000 a month for your study coordinator. This is assuming you don't give them equity in your company. Because if you give them equity in your company and they agree to it, you can pay them less because they're invested, they're an owner. All right, so full-time employee study coordinator, $4,000 to $8,000 a month. On average, again, just ballpark numbers, back of the napkin math. One patient visit will gross the site, on average, $1,000 for that visit. So just to pay your study coordinator, just to break even on just your study coordinator, not anything else, just your study coordinator, you need 4 to 8 patient visits a month just to pay that. So you can see how things get a little more complicated, and where the rubber meets the road, you got to start getting really practical about this. If I'm going to pay my coordinator $5,000 a month, can I at least get 5 to 7 patients a month to break even? If not, then you're going to be losing money, and this is not a situation you want to be in, obviously, for very long. Now, eventually, you can start scaling. I think a good coordinator can handle 1 patient visit a day. So Monday through Friday, so that's 5 times 4, that's 20 visits a month for that coordinator, regardless of how many studies you have. That's from what I've seen, and mind you, most of my experiences with complicated CNS studies, central nervous system, so for other indications it might be more than 1 patient visit a day, but 1 a day is good. So you can make 20K a month, right? Pay off your coordinator, pay your other bills. Everything that's left over is your net profit. But sounds easy, much easier said than done, especially with inclusion-exclusion criteria getting tougher. They're not getting any easier, ladies and gentlemen. Make sure you can at least see enough patients a month to pay your study coordinator and then pay all your other expenses. Thank you for watching. It's time to get real practical about this. Dan from the Clinical Trials Guru. Take care.